Okay, let's now
Constitutional
take the quiz on tongues with long vertical midline crack. So I'd like you to take a look at your tongue if you have that. No? Okay, let's begin.
Yeah.
First one. A long vertical midline crack that starts in the posterior third, extends to the tip, pale red tongue body, and a thin crack. Remember, the crack is thin. It's not
Yes, Doc.
really wide, no? Most likely indicates which constitutional condition?
Number
Uh,
one.
Number one, constitutional weakness of the heart.
A yellow greasy coating that covers
phlegm,
the midline crack is interpreted as evidence of which pathological process?
Flame fire,
Flame heart.
bleeding the heart.
Okay, Sir Mark, what are you going to ask the question when you see phlegm fire on the tongue agitating the heart? What are the possible what is the possible behavior of the patient? So first,
Pag,
yeah.
pag may flame
hindi
fire po ang
makatulog, insomnia.
yan, parang may mga, di mapakali, laging takot po, Doc.
Lagi irritable, hindi takot.
Doc, magagalitin, tapos di nakakatulog-tulog yan, Doc.
Ability.
So how are you going to tell kung like what symptom will you associate it with the phlegm? Maliwanag ba yung pag-iisip niya?
Sinabi ko, may problema, sinasabi ko sa pasyente ko po, Doc, mayroon po ba kayong pinagdadaanan recently, nakaraang buwan po ba or linggo? By interviewing the patient, nalalaman po natin kung ano yung dapat natin gawin kung may phlegm yung heart niya. Hindi ka
Okay.
ba nakakatulog?
Which combination of tongue, body, color, and coating signifies heart and kidney yin deficiency?
Right tongue.
Red.
Right. Red tongue, Doc.
Yeah, number one. Constitutional weakness of the heart does not necessarily imply which of the following?
Organic weaknesses of the heart.
Yeah, so when you see that line, do not tell the patient you have to take care of the heart. It simply means that he was born to have a weak heart, and so that means he should not be so stressed out, no? So he should take things lightly lang. In the 35-year-old female, I hope you remember the case, no? Which TCM diagnosis directly attributes the symptoms to the stomach organ?
Stomach organs.
Constitutional heat in the heart with phlegm heat
Phlegm
in
heat.
the stomach.
Di ba doon sa stomach area yung phlegm heat, no? Which
Yes,
Western diagnosis corresponds to the 38-year-old female patient? This was the second one.
Osteoporosis affecting the jaw, Doc.
Yeah. What is the primary emotional manifestation of a constitutional heart weakness?
Frequent attacks of melancholy and crying spells.
So may mga tao talaga very iyakin, no? They always have this. So you need to be aware of this. Which symptom listed for the 35-year-old female is not typically associated with heart fire? Not heart fire. Severe
fear.
The phrase rootless or peeled coating most likely refers to which of the following tongue observations?
Absence of coating at the tip of the tongue.
Which of the following best describes relationship between heart fire and phlegm fire?
One.
Ang bilis.
Number, phlegm fire, the heart fire.
Yeah. Kaya
Silent
restless. Actually, Sir Mark, I think your answer should be restless yung pasyente. Hindi mapakali. Which of the following case details indicates a possible liver involvement rather than a primary heart issue?
Ito yung ano pag may pale red.
Curled up, with curled up.
Remember the edges, no? They are curled up. That's very, liver qi constraint. Which symptom from the 38-year-old female, you may jaw pain, most directly supports a diagnosis of heart blood deficiency?
Irritability, severe irritability.
Yes. Why? Why so?
Parang nita, sinuto ko kalinding, tawag din si Manang. Ano nga?
Wait lang. Mukhang
Yan,
galing
may
ata
heart
sa
blood, may heart blood deficiency sample.
Yeah. Why can heart blood deficiency give you severe irritability? Can you tell us why, Sir Mark?
Siyempre, Dok, hindi nakakatulog yun, Dok, eh.
No, there is a reason. You talk
In
about
fact,
Shen. What does the Shen want? Diba? The residence of the Shen is what?
The
the
heart.
heart. The
Heart.
heart.
So, do
Heart.
you think the Shen will reside in the heart if it has no blood?
No.
No, so
No.
there is no
No.
home. So the patient now is restless and she might even have cravings. No? Mm. So there. So look at your tongue. Okay, and next question. How does the tongue with heart blood deficiency look like? First, what is the color of the
Pale.
tongue?
Pale.
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 Will you expect a tongue to be moist?
No.
Slightly moist, which is normal, or should you expect it to be a little bit dry? Yeah. And how would you describe the pulse of someone with heart blood deficiency? Describe the signal, just like our signal sa internet in the
Choppy.
choppy,
Parang
thin,
choppy.
choppy
Weak.
or thin.
Rapid. Choppy.
Choppy.
That's why
Rapid choppy.
Sister Rosa loves it in the Philippines, in spite of the choppy signal. Very bloody. A thin midline crack on a tongue with a normal collar. Take note, the tongue has a normal collar, and then the patient has a thin midline crack. What does it mean?
No underlying
Yes,
pathology.
nothing to worry about. Which of the following, because the color of the tongue is normal, no? Which of the following best captures the significance of phlegm in the stomach transforms into fire in the 38-year-old patient?
Phlegm
Stomach
fire. Stomach phlegm is eating.
One.
In this case, the 38-year-old patient, it is actually the phlegm fire that's causing the irritability. Remember, it's the stomach, not the heart, no? The term essence deficiency, do you see the difference now? No? So that what's the phlegm fire, the phlegm heat, no, which can become phlegm fire, is the one that makes you irritable.
Gutom.
Okay. The term essence deficiency most likely points to a deficiency in which organ system?
Kidney.
Yeah.
kidney.
Which lifestyle factor? You are very late, Sir Mark. You have to be faster next time. Which lifestyle factor is potentially preventing symptoms despite a constitutional heart weakness?
Appropriate lifestyle.
Mabilis na yung
Tongue twister.
In the 35-year-old female case, which symptom aligns with spleen chi deficiency? Accumulation of dampness.
Kapag spleen deficiency, pag may dampness,
Tendency
tendency to
to catch cold.
Okay. Yun ba yun?
Because that's me.
Which of the following is not a mental or emotional manifestation of constitutional heart weakness?
overwhelming joy.
Overwhelming joy.
So all the other three will be the manifestation. Fearfulness since childhood. So you have to ask questions like, were you always fearful when you were young, when you were still a child? depression, and emotional instability. Of course, they will not be happy. So this one is like the opposite, no? The term heart fire is most closely associated with which of the following?
Mm.
One.
Restlessness, irritability,
One, restlessness,
Yes.
mouth.
Irritability, mouth ulcers,
palpitation,
So the
mouth
best
ulcer.
answer is number one. Okay, the others do not have palpitations. Remember, this is a heart pattern, no? And also, you have to look for the presence of mouth ulcers, which we call, ito ba yung singaw na tawag sa,
Heart fire.
yeah, mouth, yeah, heart.
Mga ulcers.
Which diagnostic observation would most likely rule out organic weakness of the heart in a patient with a midline tongue crack?
Biblik po, ano, organic
Four.
Hmm?
absent,
absence of
Ay,
cardiac murmurs.
Ay, wow. So that means you will do auscultation. Okay, you start buying your own stethoscope, no? The good one.
absence of
Litmo.
guardian.
Oh, diba? Okay, so it's not too late pa, no? You might I think there are apps that make you listen to the murmurs. So who knows? You may have the murmur. Which organ scene deficiency is indicated by a deep midline crack accompanied by a very red tongue body?
siyempre, ano yan, heart,
Mm.
middle,
Which pair of symptoms from the 38-year-old case directly point to phlegm heat in the stomach?
stomach, severe irritability and exhaustions.
The phrase constitutional heat in the heart with phlegm heat in the stomach suggests what type of pathological interaction?
Stomach such as heat in the heart, driving phlegm heat generations into the stomach.
Okay, godly. Which symptom listed for the 35-year-old patient is most indicative of a possible phlegm fire agitating the heart?
Nanginginig, trembling of entire body.
In TCM, heart blood deficiency would most likely manifest with which of the following tongue characteristics?
Three.
Number one,
Yeah,
bell tongue with
tongue.
white foot.
Which of these lifestyle stressors? Minsan you have to double check looking at the palpebral conjunctiva, no? They're also very wide. Um, which of these lifestyle stressors is a background factor for the 38-year-old female's condition?
Mental and emotional pressures at work.
Kaya you should love your work. Even if you are too busy, you should love your work. You should not be pressured, di ba? Oh, look at Sir Mark. He looks so relaxed. He sounds so Which of the following explains why a thin crack on a normal colored tongue may be considered non-pathological?
Constitution.
Number
Number
number one. So you do not tell your patient you might have a heart attack soon.
dinadala ko dyan. Tinabahan.
Which organs, even if you see that the tongue is red, you do not tell that to your patient, no? Just, try to do something and try to change the appearance of the tongue. Which organ skin deficiency is directly linked to a deep midline crack when the tongue body is very red?
Heart.
Heart.
Which term specifically refers to a mental condition characterized by excessive worry and fear?
Melancholy.
Melancholy.
Which symptom combination would most likely suggest phlegm fire rather than heart fire?
Compare.
One.
Test
Number one.
Yeah,
behavior.
number one. Bad temper. Yeah. Manic. In the 38-year-old case, the yellow greasy coating along the midline
One.
is what?
Phlegm fire
Yung
the
fire.
heart.
Number one. Which emotional, you see that on a lot of patients, especially for those who are like complaining a lot, no? Which emotional symptom is not associated with heart blood deficiency?
appear per the diabetic excessive.
Heart, blood, excessive sweating. Heart.
Which of the following best describes the significance of crack covered by yellow greasy coating?
Yellow coating, indicate
Heart.
for aggravating the heart.
Mm-mm.
Yes. Which symptom is most indicative of heart fire rather than phlegm fire?
Heart,
Number one,
mouth ulcers. Number one.
Yeah.
restlessness.
Yes. So that's heart fire. So if there is like, if the patient is now bad-tempered, so that means, okay, that's phlegm fire. The term stomach deficiency is most directly linked to which of the following tongue features?
Diba? Pag pinag-uusapan, middle crack in the middle third, deep and wide,
It
number
should
one.
be deep and wide, okay? Stomach deficiency. Which of the following case details a possible spleen deficiency rather than a primary heart issue?
Dampness.
Dampness.
Next yun.
Do you agree? Dampness, no?
Yes.
Heart
Yes.
is repeatedly associated with which of the following emotional states?
Restlessness and
Joy, joyful.
Hmm?
hindi.
Restlessness and
Restlessness. Which of the
Irritability,
following is not a physical symptom of the 35-year-old female patient?
jaw pain,
Ika 38. The presence of long vertical crack in the center with slightly yellow thin greasy coating most directly supports which dual organ diagnosis?
pag yellow coating heat and phlegm yan eh. Constitution,
Number
heat,
one,
Number one. Yeah. So that means if you already have constitutional heart weakness, you are prone to have phlegm heat in the stomach. Okay? So that means you should not be pressured. You should love your work because you are easily affected by stress. Which of the following best captures the rationale for careful assessment of a midline tongue crack?
it may be
Number one.
without disease.
Yes. So that means this patient will be yours forever. Okay? Because yeah, you have to take care of the stress, no? Heart fire may present with all of the following except
Heart, pale tongue.
pale tongue with thick right coating.
the case of the 38-year-old female includes which of the following tongue edge characteristics?
Slightly red and curled up.
Curled up. Very good. Which diagnostic term refers to a condition where the stomach's phlegm transforms into a fire element?
Phlegm in stomach transform into fire.
Which symptom listed for the 38-year-old female aligns most closely with heart blood deficiency rather than heart fire?
Constipation.
Huh?
Constipation ba?
Remember, if you have heart blood deficiency, the Shen, what's the answer? Severe
irritability.
And the last question for the day. Phlegm fire is described as causing which of the following behavioral manifestations?
One.
Bad temper and manic behavior.
Okay, actually the questions are just like coming back. They keep repeating, no? And I hope you enjoyed today's mental exercise. Are you happy?
Yes.
Yes,
Thank
Doc.
you.
Well, thank you so much, everyone. Congratulations.